Hello, I'm Dr. Mahuchi at the Eye Clinic of Florida. This is a presentation I gave at Florida Hospital Zephyrhills early in November for Diabetes Month for a diabetic support group. The following is just a rehash of that presentation, so if you missed it or you want to hear it again, here's your chance. Why I'm interested. I'm an ophthalmologist, and as an ophthalmologist or an eye doctor, we see lots of complications from diabetes, so preventing those complications and treating them is a big part of my practice. I'm also a diabetic, and I've been a diabetic for more than 20 years, so I've got a strong personal interest in this subject. Diabetes in the eye. It's the leading cause of blindness for working age people in the Western world, and it's been the leading cause for the last 40 years. It's almost completely preventable. The kind of vision loss. Well, the kind of vision loss varies from mild to severe or legally blind. Legally blind means that not even with glasses can you improve the vision past 2200 in the best eye. The disease can vary between the two eyes, and early on glasses may help, but later on glasses frequently don't help diabetic retinopathy, so it's important to understand why this damages the vision. Who gets it? Well, those with long-term crappy sugar control, as measured by the hemoglobin A1C, are usually the folks who have the worst vision. It doesn't matter whether you're on insulin or not. What matters is the control. It doesn't matter what type of diabetes you have, whether it's type 1 or type 2 or pregnancy related. It's the long-term sugar control. And it's the hemoglobin over the last few years that determines who loses vision. A hemoglobin A1C that's bad once or twice probably won't cause permanent damage. However, not a few weeks, but a few months or a few years of bad sugar control can really cause permanent problems with the eye. So the most important message and the take-home message of today's presentation is for patients to know their hemoglobin A1C. It's the drug test of sugar. It doesn't really tell you the sugar right now, but what it does do, it tells you how much sugar is attached to your hemoglobin, which is on your red blood cells. And that tells you what your sugar's been averaging every hour of every day for the last couple of months, or the life of a red blood cell. It measures how thick the syrup is that your blood cells swim in. You make new blood cells constantly, so getting this test done at 3 or 4 month intervals, or less frequently if you're under good control, can help determine how good your sugar control really is. And it's an important test because we all sometimes can fool ourselves with thinking that the fasting blood sugar really tells us what the sugar really is representative of the rest of the day. It's really the average of every hour of every day which really tells you how well the sugar is controlled. So fasting blood sugars often don't tell the whole story. And in fact, for type 2 diabetics, where the problem usually is the sugar goes up and stays up after eating, testing the sugar while fasting may not really give you the full story. Although it's an important measure, it's not the full story. The eye exam. Frequently people don't understand what we're trying to do with eye exams. You really need dilation drops to see the back of the eye. The kind of eye exam we're talking about for diabetes is not a refraction, not the which is better, 1 or 2, and looking at the chart, but part of the eye exam, and what should be part of a complete eye exam, is looking at the back of the eye and seeing what is going on back there. That's very difficult to do for most doctors if you don't use dilation drops. So try to resist the urge of refusing dilation or taking the temptation to not do it because you might think you'll get through the exam faster and may see better for an hour or two afterwards. But if you don't dilate, you're really doing yourself a disservice. And it's important to note that some retail eyeglass stores won't or don't routinely look in the back of the eye. Frequently in retail eye exams, the purpose of the exam is really to prescribe glasses, and sometimes HMOs and some insurances manipulate this misperception about what eye exams are to send their diabetics to places where frequently the back of the eye is not looked at. So it's very important that when you get an eye exam, if you're diabetic, to have the doctor look in the back of the eye. You need an eye exam every year. The changes that happen in diabetes often are very subtle and can be seen very early on in the process, and usually early action prevents vision loss. So how does diabetes blind? Well, there's a couple of ways that it tears up the structures in the back of the eye or damages them so that vision is lost. And I'm going to concentrate for the most part on diabetic retinopathy. There are other parts of the eye that are affected that are less common, but less commonly the cause of the damaged vision. But in diabetes, retinopathy is the main problem, and two main types of diabetic retinopathy prevail. Leaky blood vessels are a common cause. Early on in diabetes, the back of the eye is affected so that the blood vessels outer coverings, or if you can imagine a garden hose, that plastic that wraps the garden hose is slowly damaged. You can get little outpoochings of the rubber, if you will, in the blood vessels, and these are called microaneurysms. Later on, these little damages in the eye wall can leak, and that can put fluid on the back of the eye. If you think of the eye as a camera, the retina in the back, the retina is the back of the camera or the film, and having fluid on the film can distort your image, so it's very important that you don't get that. The other way is new blood vessels growing in the wrong place, and these new blood vessels are different from the blood vessels that your parents give you. Often these new blood vessels break and bleed and can fill the eye with blood. So, here's again an example of the way the eye works like a camera. The eye is kind of more like a two-lensed camera with the cornea bending light and the lens bending light to focus things on the back of the eye. And the back of the eye is called the retina. Here again is a diagram of the eye in cross-section. And here's what we often see, or the eye doctor often sees when looking in the eye. The white structure on the right is the optic nerve, which is kind of the optic disc, which is where all the nerves, the 1.5 million nerve fibers, kind of come together and form